In today's episode, we talk about the hormone mistake you do not want to make before pregnancy. We explain what hormones are, what imbalances may look like, how to test them, what some ideal ranges of key hormones are, and what to do to balance them. Whether you are years away from trying, currently trying to conceive, or even heading into perimenopause, this episode applies to you. Without further ado, let's get started. Welcome to Healthy as a Mother, the podcast for becoming and being a mother, with your co-hosts, Dr. Leah Gordon and Dr. Morgan McDermott, two naturopathic doctors who get it.
Each week, we teach you how to be the healthiest mother you can be, from fertility and preconception to pregnancy and birth prep, through postpartum and throughout motherhood, empowering you with the natural health guidance and education you're not getting elsewhere, so you can confidently navigate the broken system at large.
The real, the raw, the untalked about. And remember, this information is not intended to diagnose, treat, or manage any disease. Always consult with your doctor before making any changes. Having adequate levels of minerals and proper hydration are essential when balancing your hormones, optimizing your fertility, trying to conceive, or preparing for pregnancy. For Dr. Morgan and I, ingredient quality is of top concern, and that's why we love Relight Electrolyte Powders by Redmond's Real Salt. Relight contains Redmond's ancient, unrefined sea salt, which contains 60 plus trace minerals in and of itself. Relight powders conveniently contain the appropriate proportions and forms of calcium, potassium, chloride, and even 2 forms of magnesium, malate and glycinate. These are essential for hormone balance, energy production, and overall wellness. The best part is they taste delicious and they have so many fun flavors. My personal favorite is lemon lime, but I know Dr. Morgan loves their strawberry lemonade. Visit redmond.life and use code HEALTHYMOTHER to save 15% off any of Redmond's products, from their electrolytes to their OG sea salt, other seasoning salts, natural toothpaste, and bentonite clays. Again, visit redmond.life and use code HEALTHYMOTHER to save 15%. Here's to happy hydrating along your womanhood and fertility journey.
All right, moms, seriously stop and listen, because this is something you need to have in your diaper bag, at your house, in the car, or basically anywhere that you spend time with your kids. Active Skin Repair is the best natural skin healing product that I have ever found. It's a skin health company that makes non-toxic medical grade sprays and gels to support skin healing by using something called hypochlorous acid, which mimics the natural healing response of the body that the body uses itself. It's very intelligent. It's an absolute game changer for a huge variety of skin ailments, including burns, cuts, scrapes, bites, rashes, stings, eczema, acne, and more. You know I love a product that works with our physiology, and this is definitely that. I use it on my baby, my dog, my acne-prone skin. It is such a smart product, and I think that you will love it. So head to activeskinrepair.com or the link in the show notes and use code HEALTHYMOTHER for 20% off of your order. So again, use code HEALTHYMOTHER for 20% off, and I think you're going to love it. Okay, welcome back to another episode. And for this one, it's for those that are wanting to get pregnant here sometime soon. Maybe that's like right now, maybe that's in a year or two. Ideally, I think we would both agree that it would be great for people listening to this to have some time to work on things in case there's some issues. But this is one of those pain points that I know that you get really frustrated with and that you wish that would change in the culture, is women thinking about their hormones before they want to get pregnant, because of how much suffering can be reduced when we don't go into it expecting one thing like easy conception, when there had been issues with the hormones, which are obviously going to then impede the process of conception. And it's like, if we had just been working on these throughout the months, maybe you didn't really want to get pregnant and you could still even be using barrier methods or some other form of not getting pregnant while doing all of this lifestyle stuff, because it takes months to affect the system. It's not overnight. You cannot do something for 2 weeks and boom, expect that that's all it's going to take. And honestly, too, the cool thing about this is that the stuff that it takes to change hormones in an optimal sense for the body changes many other things in the body in an optimal way. And it's always like that idea. I think you and I talk about this a lot, where with preconception work, people will like really focus on their health before they want to get pregnant with a baby. Well, sometimes, if that's on their radar. And it's like, wait, we should probably just be living like that all the time.
Right.
And I get it that it's hard. It's not always easy and convenient. But anyway, so today we're going to talk about how you can balance your hormones and get your body in a great state before you even start to conceive and try to conceive, so that hopefully there's less issues. You don't have to go down that route of the heartbreak and, time lost, quote unquote, because of figuring this out sort of too late.
Yeah, yeah. And we have a couple other episodes on hormones and preconception. This is sort of a hormone one-on-one. What are some like high level things that you need to know as far as what hormones are, signs that your hormones might be off, what testing to look for, some steps that you can take to just kind of optimize. And I think the first thing that I really want everyone to walk away from this episode, even if you just listen for a few minutes, is please, please, please pay attention now. Your body is talking to you. And symptoms, we are trained in our culture to see symptoms as negative, as something that we don't want and that we cover up. But the symptoms that we experience, whether that is irregular cycles, so these are some signs that your hormones might be off, which we call symptoms. Irregular cycles, so you don't have a period that comes at the same time. Painful periods, if you have acne or other skin things or hair changes, if you're tired or have mood swings, if you have low libido, so you don't want to have sex, if you have sugar cravings or you get energy crashes, in the middle of the afternoon where you're just like, oh my God, if I don't nap, I'm going to die. Spotting before your period, if you have PMS, these are all signs that something is not right in your body, and your body is intelligent and it's talking to you and it's telling you, hey, something's up. And whether you want to have a baby right now or not, obviously people listening to this probably want to be mothers someday. But regardless of when that is, whether it's like you said, in a month or in a year or two, we need to be asking our body, what does this mean? What is this symptom trying to tell me? And what are some steps that I can take to investigate that and also to help balance that now? Because I think there's another disconnect in our culture around conception and fertility, that it's separate from your health or something. I don't know. I just feel like there's just not enough emphasis and talk on your body being, in balance is what is needed to conceive and carry a healthy baby and have a healthy baby. And it's not to say that if you have any of these symptoms like painful periods or low libido that you can't have a healthy baby. That's not what I'm saying. I'm just saying that it feels very disconnected where women just kind of go through life. They're living their life, not really thinking much about it, not really paying much attention to their symptoms, or just covering it up with birth control or, ibuprofen or XYZ, name the pill for the ill. And then they want to get pregnant. And there's just this disconnect, even in the medical system, that, oh, like these things that you're experiencing could be a problem in getting pregnant. And why I say this isn't just so that you can conceive, but it is, in a way, something that I see a lot with patients that breaks my heart. And it's so classic that someone comes to me in a year or even two after trying, and they have not done any investigation into their health. They haven't really looked at these things, at the symptoms that they're experiencing, at their hormones, at their, microbiome, at any of the stuff that's happening in their body. And it's already been a year or two, and they're so over it, and they want a baby yesterday, and they're just now finding out what all of this means. And like you said, making shifts and changes takes time, and it's so sad and painful for them. Or they just want to fast track to IVF, which I get. I totally understand when you want a baby and you've been trying so hard. But if your body is imbalanced and it's screaming at you about imbalance through these symptoms and other things, then that process isn't a magical pill either. We see a lot of failed transfers, a lot of miscarriages, even with IVF. Maybe our babies aren't as healthy as they could be. So it's not like that's a magic pill. So for me, I just wish I could scream from the rooftops how important it is, no matter what route you think you'll go down conceiving or how much you think you will struggle or not struggle. I just think that it behooves every woman to start to pay attention to this and really start to work and optimize their health long before they start trying to conceive, or as soon as they learn this information on their fertility journey.
Also, like the way that you feel during your pregnancy and your postpartum is going to be drastically different if you go into it with a healthy hormonal state. It will change during pregnancy, but I just think that there's so many ways we can look at this as the motivation. Like, if somebody's struggling to care, first of all, maybe you won't be able to get pregnant until we do these things, until you really figure them out. Second of all, hormones being the sixth vital sign, menstruation being the sixth vital sign, whatever, fifth, sixth, whatever it is, very, very, very important. big, huge indicator of multiple facets of health. So if it's that off, then this is not something to ignore in general. Also, the health of your baby, also the way that you feel, all of these different things. Like, there really is so much importance, and it's just a bummer because we our rate. It takes a lot of like unraveling of the social programming, especially with women and around their periods, because it's like, oh, my period is just like a bother, and I've been on birth control because I had cramps, and I just don't really think about it, or I want to take something so that I don't have a period, or I'm on the hormonal IUD and because I don't want to have a period, blah, 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 whatever it is. And I can understand that, and like we've mentioned before, we are not anti-birth control when it's needed. It's just that like the cultural attitude of pushing away menstrual health and whatever is happening in your hormones and feeling like it can just be put on pause, like it doesn't have any repercussions to change our hormones, which are every single thing in our body. It's not an easy thing to reverse in some people, and they can have a really hard time coming back from it. Even just a couple months of hormonal birth control, like oral birth control pill use, can change things like sex hormone binding globulin for the rest of your life. So
Yeah.
I'm not saying this to scare us. I'm just saying that I think that we need to shift our mentality to say, I'm not going to view my period as a bother that should be swept under the rug and take these things to not experience it. I'm going to use it as a barometer of my overall health
Mm-hmm.
and a guiding point, which is a really good indicator of health, honestly.
Yeah.
Yes, there are very, very healthy people who still have menstrual issues. And you will know that, like, if you have something going on deeper, like endometriosis, but there is a lot that can be done. I mean, there's a systemic something going on with endometriosis, whether it's autoimmune or inflammation or whatever it is. There's something that is still needs to be helped there. And with PCOS too, like there's a lot of digging we can do. And that has downstream effects to a lot of other things going on in our body. And I will say too, with women, what is our number one cause of death? Breast cancer. What is one of the biggest interplay markers or interplaying factors with breast cancer would be estrogen, and the way that our breasts and our hormones are these kinds of like, perfect mix of area of problem. If there's years and years and years of dysregulation there, obviously also with genetic predispositions and environmental exposures, the trigger, the toxin, whatever it is that's happening in the lymphatic flow because of breast, because of bras, and rah, rah, rah. There's a lot of different reasons and things. But I guess it's just, my point is I want to just lay the groundwork for why this should be important, even if you're not trying to conceive.
Yeah.
Even if you're listening to this episode and it's 5 years away for you, you don't even care. There can be, oh, you know what? Actually, really quick, I have to say one more thing and then I want you to go off and you just pop off and you do your thing. But I was thinking about this. There is a woman who, if she ever listens to this, please contact me. I have been thinking about you incessantly. Her name was Danielle Esma. Okay. We met in like 2007. We were like 17 years old in Twin Falls, Idaho. If anybody knows this woman, please reach out to her, because we were bunkmates at this camp one time called Ryla, Ryla, and it's like a Rotary based thing. This is what got me to do my exchange year in Sweden. And she was on her period and she came out of the bathroom and she said something like, she flopped down on the bed. She's kind of a bit of a hippie and I loved it. And she flopped down on the bed and she was like, oh, I just started my period, with this like huge smile on her face. And I was like, oh, bummer.
Yeah.
Like here we're about to start this week. And she flipped over really quick with these wide eyes and she looked at me and she goes, no, I love it. I love being on my period. And I was like, what? And she kind of like writhed around on the bed a little bit. And she was like, it just makes me feel like such a woman. And like, I just feel so good being like, here it is, it's happening. She was the first person I've ever heard in my entire life say anything like that. And my jaw just sort of dropped to the floor and obviously had an impact on me. I think about it all the time still. And it's just one of those things where like, what if that was our introduction to the way that we thought about our cycles, instead of this very culturally perpetuated thing that it's such a bother. And I know for a lot of women it is a bother, but there's a reason that it's a bother. It's probably inflammation. It's probably something that's going on. It should not be that way. It should not be something that is causing you so many problems. And if it is, we shouldn't just normalize that and say, oh, well, let's just get rid of it then. No, there's a reason. Like, let's figure it out so that you can just have this be a part of your cyclical life. And as a woman, as something that you is a beautiful aspect of you, so that it can integrate with you and not be such a problem. Anyway, okay, I just had to say that.
I love that. Well, and I love how much you're talking about the cycle and the period. And one thing I want to remind people or teach you for the first time, that a lot of people don't realize is that hormones are more than just the period. So hormones are messengers in the body. And the way that everyone knows, who listens to me knows I love analogies, but imagine your hormones as like the little mailmen who are delivering messages all over the body. And they definitely play a role in reproduction and our sex hormone life, which is what rules our periods. Our periods exist so that we can have babies. Even if you never want a child in your whole life, you are having periods every month so that you can have a baby. And so the reproductive hormones are involved in that, and they can cause other symptoms, outside of just periods. You can have all sorts of stuff, like we mentioned, pain and inflammation, acne. Like these can all come from the sex hormones, even though they don't really have anything to do with having a baby. Like acne doesn't have to do with that, but it does. If you want to have a baby, if you have acne, that's really important, because that might be a sign that you have high testosterone and insulin resistance, which are two key hormones in the body that can affect ovulation, which can affect your ability to have a baby. So everything is connected. But for people who are listening, hormones are not just for reproduction, and they're not just for sex. We have hormones for sex. So if you have a low libido, or you have vaginal dryness, or you have, issues with sex, that can be another sign that hormone issues are happening. But there are a lot of other hormones in the body doing other things, like insulin, for example. Insulin is a hormone that is not a sex hormone. It actually signals your body to take in glucose when you eat your food so that your body has the energy that it needs to do things. And your thyroid is another important hormone that doesn't necessarily have to do with your period, even though it does impact it, and it does impact fertility because everything's connected. But this will make you gain a lot of weight if it's low, or make you lose your hair, or make you have cognitive issues, or brain fog, or brittle nails, or dry skin. And so there's all sorts of stuff. But the key understanding of hormones is that they're messengers, okay? So we talk a lot about hormone balance and getting your hormones in balance. And there's a lot of emphasis put onto the hormones. Even in the natural wellness world, there's a lot of emphasis put on hormones, and they will prescribe certain supplements and herbs to balance that hormone. And I'm not saying there's anything wrong with that. I definitely do that with patients. For example, Vitex is an herb favorite of mine when someone has low progesterone. But like you said, they are messengers. And so we often blame the messenger, right? If your mail doesn't show up, if your Amazon package doesn't show up, it's not probably the Amazon delivery man's fault. There's probably some big underlying bigger thing happening. Maybe it's a snowstorm. Maybe like the trucks broke down. Maybe there was a fire at the Amazon warehouse. Like there's some underlying thing. It's not the Amazon delivery person's fault. And that, just focusing on that, like yelling at them or trying to balance that delivery driver. Let's try to get that delivery driver to like be a better delivery driver. It's like, okay, but like that's maybe he's just doing his job, right? Like he's just trying to do the best he can in an overwhelmed environment. So the body is the same. If there are imbalances in something like, for instance, progesterone. Progesterone is a very important hormone in the reproductive world, in the pregnancy and fertility world, and even outside of pregnancy. If you don't have enough progesterone, you're going to have things like PMS. So before your period, you're going to be cranky and moody and tired and just angry and, sad, and have pain potentially, pain before your period, bloating, all of these things because your progesterone is not high enough. And sometimes we just want to give progesterone, right? That's the conventional way of like, oh, your progesterone's low, let's just give you progesterone. I absolutely do that in practice, especially to save a pregnancy. But we want to ask these bigger questions, and we can ask these bigger questions early on when you are not in the throes of like, I just took a positive pregnancy test and my progesterone is low. That's a very different situation. I'm not going to be like,
then we do say
a gut test.
Yeah, then we're like, go for it. You need to just do it. It's too late.
You just give progesterone, and I've helped a lot of women save losses that way, previous losses that had a same situation. And there's a time and a place, 100%. But why I'm talking about this now is if you're in that season before you have a baby and you can take some time and you do test and find that you have low progesterone, for example, let's ask him some bigger questions, because it's not progesterone that's at fault. It's what's happening with your nutrition. Do you have enough of the building blocks to make progesterone? What's happening with your inflammation? inflammation is like your body's on fire on the inside. That's like an Amazon fire in the warehouse. And that can come from your microbiome, and that can come from certain foods that you're eating and stress. What's going on with your stress? So hormones are not necessarily the root cause behind problems. They are just a reflection of what's going on internally. The cool thing is they are an easy thing for us to test and look at to give us a pulse on what is going on in the body. Because it's kind of hard to know, like, am I too stressed or not? Do I have inflammation or not? Like that's so subjective. It's really hard to know. If you do test your hormones and they are off, that is a clear sign to me that there is some imbalance going on that we need to address. And that is why looking at your hormones, not only from the symptoms that you're experiencing, but also potentially testing early on, can give us the clues to help. We're like a detective, right? To see, okay, where do we need to go now? What further questions do we need to ask? What things do we need to shift and change in our lifestyle and our diet and our approach to our health, so that we are just in this optimal place of health? And then pregnancy and fertility and a healthy baby are just like the side effect of that, right? They just are, that's just like the natural, spontaneous way of the female body.
And if that's not happening, there's obviously something blocking it. That was one thing that I thought in school, that philosophy shift in my mind. I always thought to myself, if somebody was having something wrong with their health, they needed to like do more, like do something. They're not exercising. They're not eating enough vegetables. So they're going to add into their day in order to fix their body. And then the idea where it was like, what blockages can we remove?
Yes.
That was such a big shift for me. I had just not thought about that at that time. This is like during medical school. That's the whole point of medical school, is to teach you to think about that kind of thing. And but I just remember that really standing out to me, being like, oh my God, and that's when we started to talk about things like spousectomies.
I know.
Like
jobectomies.
Yeah. Some people have just these constant stressors in their life where they're never going to be able to be well in front of that. Or maybe it's a habit like smoking, or so I was just thinking about the patient that you and I both kind of consulted with at the same time, our friend, who we're not going to say her name, but she did a Dutch panel and had zero progesterone, zero. And there was like no reason for that. And it took further investigation, because something like that was maybe an indicator. It could have been wrong, but it also made us think. There were some other things in the panel about the hormones that made you think about mold.
Mm-hmm.
And then she ended up testing where she lived, and it was like a whole thing, and it took like 9 months, but it was a big deal because she had actually very, very high mycotoxins in her body, and it was affecting her hormones downstream. So like, thank God she, you know what I mean? Like, isn't that a gift that she figured it out?
Oh, such a gift. Like literally, oh my gosh, test your progesterone. If I had to pick one hormone, just one, if someone's like, I get one, like,
what is it?
Have one, it's progesterone. Luteal phase.
Because of the egg health, indication there.
Because I feel like progesterone. This is what it is. I love that you asked this question, because I'm just reflecting now in my brain why. It's because I feel progesterone is much more delicate and sensitive to issues. Like, I feel like it will be flagged sooner than other hormones. And I say that with caveats. Everything that I say is like, well, it just depends. For example, a lot of people have estrogen dominance, meaning they have higher estrogen relative to progesterone. And we do, based on the toxins in our environment and a lot of the foods and stuff that we're eating, a lot of people do have higher estrogen. But I don't feel like in general, higher estrogen causes as many problems, at least in the reproductive years. Yes, with breast cancer and things like that, high estrogen can be a problem. But most women who have high estrogen aren't like, oh, I feel so bad from high estrogen. It's usually that they have low progesterone, and it's a relativity difference. So when you have PMS, when you have bloating, when you have all of these things, it's not necessarily because you have high estrogen. A lot of times it's because you have lower progesterone, and so it's relatively higher. Whereas if you had that robust progesterone, it would be okay. And I just personally see, like, if you have inflammation, if you have stress, if you have nutrient deficiencies, if you have poor quality eggs, then your progesterone is going to suffer sooner and more dramatically than many of the other hormones. Obviously, if you have insulin issues, you can have testosterone problems. For example, if you're a kind of person who has acne, or you have PCOS, or there's metabolic issues going on, sometimes your testosterone can be high. But even still, I would say that's less of an indicator of like overall underlying factors besides metabolic stuff. It could also be low from stress and things like that. Like every hormone has its way. And I actually teach this inside of my membership that's launching soon, about all of the hormones. But I would say progesterone is the most important. And although you need estrogen to become pregnant, you have to be able to build that lining. I find it's much more common for women to have enough estrogen. Like it's enough. You don't need like, crazy amounts of estrogen. It doesn't take a lot to make enough lining, but you absolutely have to have enough progesterone or you will lose the baby. And it's just important. It's just important. So it's an important marker because it tells you what's going on, and it's essential to have more so than I think the others to get pregnant.
And I mean, I don't know if this is on our listeners' radar yet, but it's been in conversation about perimenopause, and it's something that we're all going to experience. I'm really not looking forward to that, but again, issues of progesterone. The longer that we can keep our progesterone in a good, healthy way, the longer we will have years of fewer symptoms or no symptoms. I mean, it's a long sliding scale to go into it. And yes, there's this whole like philosophical debate about bioidentical hormones. Do we just put everybody on them and whatever? And I know you and I are kind of on the same page, which is like we see the time and place for that, but also it's problematic that everyone is just having this expectation that they're going to be on them. And it's like, well, wait a minute, isn't there a physiological purpose to also the stopping of fertility, and then like having to kind of deal with that and enter that crone phase of our lives. But anyway, I guess I just wanted to say, one time a friend recently said to me, she's going through perimenopause right now, and she was like, keep your hormones as healthy as you possibly can for as long as you possibly can, because this sucks.
Yeah, it does suck. And it's a lot of times it's progesterone. So what I tell my perimenopausal patients is your ovaries are starting to retire. And for those who don't know like the anatomy of hormones and stuff, if you want to learn, again, it's in my membership, but you can probably even Google it. But basically, your ovaries are making estrogen, which is this key hormone that you have at the beginning of your cycle. It helps build that uterine lining. It helps you feel good and voluptuous. It's what gives you big boobs and, all of the like feminine.
I don't have that. Is it all right?
It also in excess can cause pain and inflammation for sure. Like that's what we see in endometriosis and breast cancer and polyps and fibroids and all of that. They're usually estrogen driven, but we have estrogen, and that is made from our ovaries, from, the stimulation from a hormone from our brain. And then once we ovulate, so we get estrogen, some testosterone's in there, then we ovulate the egg. And then the outside of that egg that we ovulate is what makes progesterone. Well, during perimenopause, our ovaries are starting to retire. So they're just not playing that game anymore. And what happens is your adrenals take over. So always our adrenal glands, which sit on top of our kidneys, they make our stress hormones. A lot of people just talk about the adrenals and our stress hormones: cortisol, epinephrine, norepinephrine, adrenaline. That's the name for adrenaline. So they make our stress hormones, our adrenals, but they also make some of our sex hormones like estrogen and progesterone. So when you're going through perimenopause and your ovaries are starting to retire and sputter out, and sometimes they're working and sometimes they're not, the backup for your hormones are your adrenals. And this is something a lot of people don't focus on. And this is also why in your reproductive years, having stress is one of the biggest things that impact your progesterone as well. But in perimenopause, if you can really give love to your adrenals and work on your stress, herbal adaptogens, all of the things that love on your adrenals, you can often mitigate any of those crazy symptoms that women experience, the hot flashes, the up and down, the moods, the craziness, by stabilizing your adrenals, because that's like your backup generator. And so again, early on in your life, let's say you're in your 20s or 30s and you're not yet having kids, all of this work, this underlying work of checking your progesterone, checking your other hormones, finding the underlying roots as to why they're imbalanced, whether it's your adrenal health, your stress, microbiome issues, inflammation, nutrient deficiencies, blah, 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 childhood traumas that like keep all of that, stirred up. Like if you can do that kind of work now, not only will it help you get pregnant easily, it will hopefully help you have an easier pregnancy and postpartum, but then it also sets you up for perimenopause because you are already taking in these changes into your life, this awareness into your life, these lifestyle changes that stay with you hopefully forever. And so then you're just set up much better into perimenopause because it's all the same stuff, right? It's all connected and it's all underlying. And so I don't know, I'm just such a believer in, testing your hormones and knowing what's imbalanced and working on that at whatever season of womanhood you're in. But you have such a gift if you are doing this before you have kids, because it's not that you can't make these changes after you have kids. You absolutely can. It's just, there's just more obstacles, right? That you are also navigating with motherhood.
Yeah. And you don't want to, a lot of people, just because of the ages of women having babies later on, they will basically be postpartum and sliding directly into perimenopause.
Yes, exactly. Mm-hmm.
And that's going to be harder. It doesn't mean don't do it, don't have your children, but it's just something to be aware of. I can even feel in myself, I don't know what it is. We just talked about this on the other episode about how I want to get I've never ever had my hormones tested, and I want to have you like live interpret them for me. But I can
wait.
Yeah, I can feel something is happening to me. Like my luteal phase is not fun anymore. And it was, and it was fine. And so I think my progesterone probably is starting to change. And that's scary. I'm 35, I don't want that to be the rest of my, or for this to be the start rather. So just paying attention to our bodies and noticing like, oh, is there starting to just be more present with yourself? Is there a time of your month where you're obviously PMS, everybody knows that the days leading up, but I don't think the people make the connection that it's actually that last 2 weeks of this the cycle where you'll have those sorts of irritation, anger, sadness, whatever it is. But they are clues, right? Like what's going on with your body. So why don't you tell us some of speaking of symptoms, let's talk about what are the symptoms that somebody could be experiencing to lend them to like explore this further.
And now a word from our sponsor. Did you know that while 97% of women in the US take a prenatal supplement, over 95% are still deficient in key nutrients? That's why I love and recommend the Needed Prenatal Multi. Unlike most prenatals that offer the bare minimum, Needed goes above and beyond, using nutrient forms and dosages that truly support mama and baby to thrive. I've actually worked with the Needed team for years to help create this formula, and we spent over 3 years researching, collaborating with practitioners, and ensuring every nutrient choice was intentional. And now we have data to back it up. In an IRB-approved clinical study, women who took Needed's prenatal multi had significantly higher blood levels of essential nutrients like vitamin D, B6, riboflavin, B12, K2, and selenium, compared to women taking a standard prenatal. Even more powerful, only the Needed prenatal group reached sufficient levels of vitamin D, which supports a healthy immune system, bone strength, blood pressure regulation, and more. Women on the standard prenatal actually had vitamin D and B6 levels below sufficiency. This study reinforces what we've known for a long time, that real nourishment matters. Nutrient sufficiency supports fertility, a healthy pregnancy, and baby's development. Needed isn't just aiming for adequacy, they're proving what's possible. No matter where you are in your fertility or motherhood journey, the Needed Prenatal Multi is the one I recommend. Learn more about nutrient depletion and how to support your body and baby at thisisneeded.com/thrive and save 20% off your first order with code HEALTHYMOTHER. Again, visit thisisneeded.com/thrive and save 20% with code HEALTHYMOTHER. Okay, now back to the show. Yeah, so I mentioned them in the beginning, but just anything that feels off. So irregular cycles, like your cycle's not coming on time, which, you talking about which part of the cycle that you're in, some of you listening might not know even how to track your cycle. Again, I teach all of this in my membership, but that would be the first place that I would start, is learning when your cycle starts, even just keeping track of it on an app calendar. There's lots of different ones out there, free ones, paid ones, all sorts of ones. I use Kendara. I think you use Natural Cycles because you use it with the Aura Ring. That is a great one if you're like really serious. I don't have to prevent pregnancy because my husband's infertile. So I don't necessarily have to pay for that one, but if you're trying to prevent pregnancy, I would be probably on something like that. Or you can, do any sort of cycle tracking stuff. Like I said, I have a course in my membership to teach you how to do that. But you would know then if you have irregular cycles, you would then know if you have cycle changes, or symptoms that change around your cycle, like extreme fatigue, maybe skin changes, painful periods, spotting before your period. Like you would be able to track all of this if you start tracking your cycle, and that will really be helpful. If something seems consistent and it doesn't really seem cyclical, that could be something more like insulin or thyroid. So that could be fatigue after meals. That could be weight gain that just seems stubborn, brain fog, hair loss, dry skin, brittle nails. But anything that just feels off, where you don't feel alive and well and vibrant, and there's pain, there's imbalance, it just doesn't seem right. These can all be signs of hormone imbalances. And so the first thing that I recommend, like I said, is tracking your cycle, paying attention to when certain symptoms start. I do like in Kandara because you can put your symptoms on the day and then you can kind of see how they track through the cycle. I'm sure that Natural Cycles and stuff has those options.
Yeah, it does. And I wasn't using it for a while, and then I was like, no, I need to actually start doing this. And I'm noticing that I'm having like a real drop off in my mood, like the day after I ovulate, maybe 2 days after I ovulate.
Yeah.
And
That
then
makes
it's
sense.
like for like 2 days, I'm real mad right before I ovulate, which I love ovulating. Like I feel so good. And then all of a sudden it
Yes.
feels so bad. And then it starts to kind of level out, but it's very consistent now because I've been tracking it, that it
Oh, I
just
love that.
tanks. And I don't know what that is, but anyway, we're not talking about me. I just
No,
wanted to
it's
say
okay.
that, like,
We are talking about you. I mean, let's just think about it. It's probably because your testosterone is rising, because testosterone and estrogen both rise in that follicular phase, getting ready for ovulation. And then you have this surge in estrogen that triggers the LH. That's what makes you ovulate. And then that drops. So it's probably your testosterone's higher relative, and you have a surge and drop in estrogen. So you're now left with no estrogen and high testosterone, which will make you angry.
oh,
And make you
I
want
don't
to
like
fight
that.
somebody.
I don't want to be on testosterone. It makes me feel very aggro. Yeah. Like I'm just like, rah, like, rah,
Yeah.
rah. And I don't really like get mad about, things that are going on in the world, but that is, if I'm going to, that's when it is. And
Yeah, well, that's testosterone. That's like road rage, like the classic like man with like the big veins. It's like, he has too much testosterone, obviously, and bald. It's like these are signs of really high testosterone, but that's what makes them angry in inappropriate amounts, right? But it can happen in women too, and it's all relative. And so even if you are on testosterone therapy, like someone like you, not that I'm saying that you should be, if you were going to go down the bioidentical route, someone would probably also need to be on estrogen and progesterone, because it would be too much to just be on testosterone unless you had true low testosterone. This is why you can't just do like blanket statement for every person. But anyways, that's just a sign. And I'm so glad. So I tracked my cycle and figured out, because I would have like, this was before kids when I had a lot more imbalances. My period or my boobs would get all swollen and sore, and they'd be lumpy and painful. And I'm like, what is this? And sometimes they were, and sometimes they weren't. And it's before you have this connection to your cycle that you just don't realize. I remember when I consistently tracked my cycle for 2 or 3 months and I started paying attention to my symptoms, that I was like, oh, this happens before my period. It's like, duh. But you don't realize that that's the case. And then you realize it's hormonally driven and blah, blah. And anyways, I did lymphatic drainage stuff, and that helped so much with my boobs. So that's a fun tip for anyone. But anyway, so cycle tracking. And then I would absolutely recommend testing. I am a fan of testing hormones. Some people are like, don't test, just like whatever. But I just am. And because I've had patients that you would look at them and be like, wow, you are the healthiest person I've ever seen in my whole life. You probably have nothing wrong with you at all. And then I test their hormones, and it's like, whoa, you have Hashimoto's, you have low progesterone, you have, insulin dysregulation, like XYZ. You can't really look at someone always and know. Even me, I'm a very healthy person. I'm a very health conscious person. My hormones look so crazy, and I feel great. Like I have great thyroid health. All of that. But as far as like, I have high prolactin outside of breastfeeding. I have low testosterone. This I think was from, birth control and maybe chronic stress from school, like all sorts of stuff. So I'm coming in, I think I look relatively healthy. I have great energy. I have normal periods. You would probably think like nothing's wrong with you, but I have a whole lot of stuff going on with my hormones. And it's something that has helped guide the way that I am in the world, how I am with blood sugar because of my insulin and how I, interact in the world and catching things like progesterone. So I'm a huge fan of testing. I have a whole free guide on what labs to test. If you go to womanhoodwellness.com/free, it's the female lab list. And so I'm just going to go through a few high-level ones, but I have the whole list of everything I test. And inside of my membership, you'll be able to order labs on your own for much cheaper than you would going through a doctor. But you could ask your doctor for these. Sometimes they just don't want to run all of the labs that I like to see, and it's just a lot cheaper to do it through a cash-paying lab. But some important ones, like I said, are progesterone. This supports pregnancy, implantation. It's essential for feeling good throughout your cycle, like you mentioned, for perimenopausal time. It's not just for pregnancy. And you want to check this in the mid-luteal phase. What that means is a week after ovulation. If you don't know when you ovulate, this is a great time to practice cycle tracking. So you definitely want to catch this at that right time. And ideally, we want this above 10. For conception, we want it above 15. And if you have a progesterone lower than 10 for sure, you're probably not going to be able to hold a baby. That is a very classic miscarriage, window where you might be getting pregnant, but you're not staying pregnant and you're losing babies around 7 to 9 weeks-ish. That time frame is very classic progesterone. So very important, something I don't want anyone to experience. You can do a simple test ahead of time and then start working on that. Like I said, I have inside of my membership all of the lifestyle, herbs, everything to help each of these hormones because it's a lot to get into. But the next one is estrogen. And this is one that you want to test around day 3. So other than progesterone, all of these other things can be tested around day 3 of your cycle. What that means is the first day of bleeding is day 1. So you go, you see you're having your period, 3 days later is when you test. So estrogen thickens that cervical, or it thickens the uterine lining, and it's important for cervical fluid. And ideally, you want this between 25 and 50. And then pre-ovulatory, so right before you ovulate, between 150 and 300. And again, I have all of this on the guide, but this is an important one. And if you test, let's say you're trying to get pregnant or you're wanting to be pregnant in a year, and you test your estrogen and it's like 10, that's a problem. That you might not know. You might have really light periods. This is another classic that I see in patients. They're like, yeah, I have like really great periods. They're like 2 days. I don't really bleed that much. And I don't really have any problems. Like, it's really great. I'm like, oh, great. Like, you might not have a lot of estrogen. And that might be a problem getting pregnant. And then we investigate and look deeper, and they might have something like premature ovarian insufficiency, which means that you're almost going through menopause too soon. You're maybe in your late 20s or early 30s and your body's already retiring. The ovaries are already stopping. And that means you're not dropping eggs and you can't get pregnant. And, I've had patients with that experience, and you would never know. Looking at them, you would never know, And so if you don't test and you go on trying to conceive for over a year and you don't know that you're not making enough estrogen to make a uterine lining or to drop an egg, like, that's a problem. And you can just test it so easily. So I'm just a big fan of that. Also looking at your thyroid, I'm a huge fan of doing a whole thyroid panel. The whole list is on that guide, but definitely just starting with TSH. But I test everything. That can be another big factor in how you feel and your fertility. Things like prolactin. Prolactin is the hormone that we make when we're breastfeeding, and that's good and important, and it shouldn't be high when you're not breastfeeding. And I see it high in women all the time who are not breastfeeding, who have never been pregnant. And this is another one where you're like, whoa, I would have never known. There's no really clear signs or symptoms even really with prolactin being high, other than maybe low libido. That could be a factor, that prolactin could be high, and that can impact ovulation. It downregulates your other hormones and can cause a bunch of problems. The last one I'll talk about is insulin. Like I already mentioned, this is an important one. So we think of insulin more with metabolic health, but it's very important for getting pregnant as well. And PCOS is the number one. PCOS is polycystic ovarian syndrome. It's the number one reason for female infertility. And the leading underlying root factor in PCOS is metabolic dysfunction and insulin dysfunction. So even though people will be like, oh, just take testosterone blocking medications like spironolactone if you have acne, or just do IVF, it's like there is a clear metabolic issue going on. And that is not, if you don't address that, at least try to improve it. that's going to really impact you in your pregnancy. You might, then lead to gestational diabetes or have issues with your baby. And then you're going to have, issues ongoing. Not to say that, you have to cure your PCOS before you get pregnant. That's not true. But just being aware of where are you at metabolically? What is going on with your insulin? And is that a factor for you? So I'm a big believer in empowerment through knowledge about your own body and learning how you can really make changes. And these changes are so exciting if you can do it before you get pregnant or anytime. Like I said, no matter where you are along this journey, it's all really helpful.
And I mean, as your specialty, you do this with women all the time. This is literally what you do. You make these changes. You see how it impacts them, how it changes their blood labs, it changes their symptoms, it changes their ability to get pregnant. It's not something that's like a written in stone. This is the way your life is for the rest of your life. Like it's something where you can move the meter. I wanted to say two more things. One about the days of testing. I've definitely heard from patients, clients, friends going through more of a conventional route of fertility treatment that the test, they'll be like, oh, well, they already tested my estrogen and they did it. And I'm like, well, what day did they do it? And they're like, I don't know. It was, and I'm like, well, did they tell you to come in on a certain day? And they're like, no, but they said my hormones were fine. And I'm like, no.
Oh my gosh. It drives me crazy.
I know. And it's very, very simple and important to make sure we're testing these markers on the appropriate day. It would be like testing a man's testosterone at any willy-nilly point and then taking that. It's like, no, you need to test it in the morning. Like there are times when we have to do these things. It's like taking a fasting glucose and not taking it fasting. Like, how are we going to utilize this in a helpful way? You must do those on day 3. You must do your progesterone mid-luteal 1 week after your ovulation, whenever that was. If you ovulate on day 14, then cool. It's going to be around day 21. If you ovulate on day 20, then cool. Then it's going to be day 27 for you, whatever. You need to know these things. And it really does matter. And then about prolactin, I just like really quickly saw a case go through before my eyes, which is of like the woman who gets the conventional testing, they're not going to test prolactin almost or rarely. And they're going to say, oh, we cannot figure out why you're not ovulating. This is so strange. I don't know. You're 25 and this is happening and this is happening and rah, rah, rah. And yeah, but you're just not ovulating consistently or whatever it is that's going on. And then maybe somebody like you comes along and tests their prolactin and it's high, whether it's high because of, maybe a sex hormone binding globulin kind of situation or something other than some other downstream effect from being on oral birth control pills, or a prolactinoma, which is like a benign tumor in the pituitary gland, which happens a little more often than you'd think. Without discovering that, we are going to we can do things to reduce the prolactin so that you can ovulate again. But how many women are told, oh, everything looks good. It looks fine. Just keep going.
Yeah, so many. I know.
And
I
woman
see
will
patients
keep going for years and still not get pregnant because there's something that needs to be addressed.
I know. It's just, it blows my mind. And this isn't to like diss conventional medicine. It's not their fault. It's just
not complete. It's not complete.
It's not complete. And it's, they're practicing within some strict guidelines of insurance models. And you cannot order this test unless there is a diagnosis that we are trying to diagnose and blah, 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 blah. That's why if you go to your normal doctor and ask for these labs, before you start trying to conceive, they will literally laugh in your face. They will laugh in your face or they will tell you to get out, and they will not. They will not do it because there is no illness or disease that they can code these labs to. The only reason that they start checking fertility stuff, which is still minimal if they do it, is after a year of trying to conceive, when you are diagnosed officially with infertility. That is when they can say, oh, I can write, this test to this code of this diagnosis code of infertility. There is no preventative medicine practice in the conventional model. They don't say, let's proactively test to see if there's any problem that we can avoid and mitigate so that you don't have to go through infertility, so that you don't have to spend a year of your life trying when, we could have tested your partner's semen or your hormones long ago. They just don't work in that model. And
I have an idea. I think that you need to put together a presentation and go and teach them. I think that I'm sure that they'd want to know if they knew that, but maybe they wouldn't, honestly, because then they wouldn't be making as much money. It's complicated. It's a very complex thing. It's not the individual's fault. It's just that it's like,
It's
how
the
do you,
system.
yeah, it's the system is not recognizing of the fact that these things contribute, and it's not doing anyone any favors. So anyway, sorry.
No, it's
But I
not.
really do
So,
think you would be such a good teacher for.
oh, thanks. I mean, some doctors, so when you see a functional medicine practitioner, usually it's someone who was trained in the conventional world and then was like, had an epiphany. They're like, oh my gosh, I want to do preventative medicine, or I'm seeing like this root cause medicine seems to really be helping people. So they go and do extra training to learn what we learn as naturopathic doctors. So I have seen it, at IFM conferences and stuff. Doctors, like, they're so excited. They're like, oh my gosh, like, I want to learn about hormones and I want to learn about how gut health and how it's all connected, and it's great. But it's just not, you're very much a black sheep if you go outside of the conventional model of what is done, and you have to have really thick skin to be doctors like us, because you are going against the grain and you're going against a huge insurance medical system that is just like ginormous. And so for me, I just play outside of that. And so when people ask me, okay, how do I get my labs tested? We have to talk about that to talk about this. Because if you just go to your doctor and you bring them this long list and say, these
I
are the
want
labs I
that.
want
Yeah.
tested, they literally won't. They won't do it. They will maybe pick and choose. And the ones I'll tell you right now that they'll do is the CMP, the complete metabolic panel, and the CBC, which are two super basic tests that almost everyone has run. And they are okay, but they don't tell us that much information. Like, they'll highlight, some insulin, or not, they don't test insulin, but your glucose, they'll look at your liver enzymes. And if you have severe anemia, they will maybe catch it. But that's about it. It's not really looking at your hormones. They will maybe run your estrogen, FSH, and LH.
But again, they could be doing it at any
At the
point in the
wrong
cycle.
time. Yeah. That's about it. Like, maybe if you beg them, and you tell them you have a family history of diabetes, they will run fasting insulin. But most likely they're just not going to run the complete list of everything that I like to see on people. So you can absolutely ask for it. If you have a cool doctor, great. But there are ways to do it on your own. Like I said, inside of my membership, you can have access to order. And I think it's $250 for the whole panel. That if you went through insurance through like a Quest or a LabCorp, would be $5,500, because someone was trying to do it the other day. Yep. And I was like, no, do not do that. Do not go to like LabCorp and try to submit that to your insurance. They will not cover it because there is no disease. They will not cover it because you do not have a diagnosis clearance. This is how our medical model works. If you want to do preventative medicine, if you want to do, root cause medicine, unfortunately, you kind of have to play outside of the insurance model and pay cash. But $250 cash versus submitting to insurance and, them not covering it, sometimes it's easier to just pay cash. So that's what I do in my practice. And you can do that on your own. Like I said, you can click the link in the show notes if you want to join the membership and get access to that. If you want the list of labs, though, and you want to try to work with your doctor, it's at womanhoodwellness.com/free. I have that whole list there. And then to just leave you with some final, like, things to work on as far as how we actually shift the hormones, it really depends on what's imbalanced for you. And whether you have low testosterone, low prolactin, high prolactin, low progesterone, high estrogen, low estrogen, like, they all mean different things. And the way that we address them with natural medicine, lifestyle medicine, herbs, supplements is all different. Like I said, I have all of that in my membership, but the foundations of health, which no one likes to talk about and everyone rolls their eyes about, are the key. You do not need fancy herbs and supplements and all of that to get started. You can make so many huge changes by just working on the foundations of health. And they're so boring and they're so important. And you just have to start implementing it into your life. And those are things like eating breakfast. Eating protein for breakfast. Like, that's the thing. If I could change everybody's hormones, it would be eat protein for breakfast, before you drink your coffee.
And you'd be shocked at how many, like, some people who do that all the time and they're like, what? But you'd be shocked that how many people are resistant to that one thing. They
Oh,
cannot do it. They don't want to do it. They wake up nauseous. They're like, I can't eat breakfast. I hate breakfast. I can't eat for the first
yes.
4 hours. Or they want to intermittent fast. And it's like, that's a real specific
Problem.
body type that is going to want to do that. But it doesn't mean that it's not for everybody, but it's just,
Yeah.
or sorry, no, it isn't for everybody. I will say that intermittent fasting is not for everybody, but it doesn't mean that it's not maybe appropriate for that particular person. But like, there are so many people that refuse breakfast, like straight up, flat out.
Yeah.
Anyway,
And
so
one thing I want to say to that, if you are the person who wakes up nauseous and you're like, I cannot eat, I'm so nauseous, there are two things that could be going on. Well, there's probably more, but these are the two things at the top of my list. If someone told me that, I would think your cortisol is very high, which is your stress hormone. And that cortisol is pumping all night and it creates this nausea picture in the morning. So working on getting your stress under control, which again, I have a whole module, a whole course on that in my membership because it's like, what? How do you get stress under control? But that's important. And or you have a higher toxic load and you're dumping bile acids at night, your body's trying to clear out, but you have like a sluggish gallbladder. And so the toxin load of what the bile is these like salts that are in your digestion that break down fat. It's like a whole complicated thing if you don't know about it, but basically they dump at night. And some people, a lot of people, especially if you have higher estrogen, will have sluggish gallbladders. And that toxin accumulation and those bile acids are not getting flushed out of your system. And so it sits at night and then you wake up nauseous because you have all of these circulating toxins and bile acids. So also a hormonal problem and a gut problem that you can work on. But those are the two reasons. And so it's not normal to wake up nauseous. You should wake up, have energy, feel amazing and alive, and have an appetite. That is what is normal. If that is not happening, it's not because you're just unique. Like I had someone tell me, she's like, I'm just a night owl person. I have a different circadian rhythm. I'm just meant to stay up late and I'm so nauseous in the morning. I'm just not meant to eat breakfast. I'm just like, I get bio-individuality, but I also think that like there's something wrong there. Like you have a flipped circadian rhythm. So you probably have high cortisol at night, low cortisol in the morning. So you can't get up, but you stay up late. And you have, high cortisol again that could lead to the nausea and or gallbladder issues, sluggish gallbladder. That's not a typical hormonal rhythm. If you were free of all the toxins and all of the EMFs and the stress and all the things, if you were just like a natural human living in like our natural environment without all the technology, like that would not be how you would be. You would not be staying up till midnight.
And you can't see anything.
Yeah.
And so you go to sleep.
Yeah. And you would wake up and you'd be like, wow, I'm ready to start the day with the sun. It's like, I'm up and I'm going to go, hunt my buffalo or eat my berries or whatever. Like you would be hungry because that's the biological rhythm. So a lot of us have that flip flop, not because it's your fault, just like because of different circumstances and things. And so that's what I have to say to the people who don't want to eat breakfast. It's very, very important though, because that sets your insulin for the whole day and it's hard to get it back. Even if you're like, well, I don't eat breakfast, but I eat a really good lunch and dinner. At least in my experience, once you've set your insulin train for the day, it's really hard to get it back on track. And your insulin, cortisol, and melatonin. Insulin rules your blood sugar. Cortisol is what rules your energy, your daytime energy, and melatonin is your sleep hormone. So those are the 3 daily hormones that are the most important to get in balance, that then set the foundation for your sex hormones to be in balance, which are your monthly hormones. If you do not set your daily hormones in balance, you cannot balance your monthly hormones. You just can't. Like they are the foundation. So we start with that. We start with waking up. If you can get sunlight in your eyes, great. I get it. We live in Idaho in the winter. It's dark until like whatever. That's fine. Just like do the best you can. Eating breakfast, doing some gentle movement in the morning, really eating consistently throughout the day, focusing on protein, fat, whole foods, and then really focusing on that bedtime routine and making sure that it's darker at night. You don't have a TV in the bedroom. You don't have cell phones in the bedroom. Those are the first things I do with my patients. And that's what I'm going to leave you with because I feel like they're actionable. I say, we're changing your breakfast and I just want to do an experiment. For 1 week, I just want you to eat high protein breakfast for 1 week and see how you feel. If you have a TV in the bedroom or you're a person who works on your laptop or scrolls on your phone in your bedroom at night, that's going. I get those.
I did this with my brother-in-law. Even men too. He was working outside as an electrician in the summer,
and just really not feeling well, but he would wake up and have coffee and then go to work and wouldn't eat anything. And then he was having like all these symptoms and stuff. He's a very Vata body type.
Yes.
And I was like, yo, you got to wake up and eat. You have to eat like 30 grams of protein. And so that's exactly how I positioned it to him too. I said, just do an experiment, do it for 1 week.
Yes,
and if you feel nothing, then whatever. You know what? 100% of people who I've ever told this to, I'm sure you as well, who try it for a week are like, my life has changed.
Changed forever, literally.
Forever. They will never go back. It's so simple.
I know. So that's what I want to lead you with. Like, yes, we can talk about all the herbs, and we studied for years and years and years, you guys, every herbal medicine, every supplement, every this and that. We know so much about. And there are amazing things, that we can do to shift hormones. But if these foundations are not in place, it's like, no.
No. I had a patient one time that you're reminding me of, who was probably this like 65-year-old man that came in on, I'm not kidding, maybe he was on 45 to 50 different supplements. And all he ate was fast food, burgers and fries every single day. He was like one of those people who was extremely routinized. Like he did not want to change. He was just like, this is what I do. I wake up and I do this, and then I wake up and then I do this, and then I do that, and I do this, and blah, blah, blah. And he was coming to see if he could optimize his supplement regimen better to prevent heart attacks, because he has a high heart attack family history. And he'd already had a stent placed and all of these different things. And I was like, wait a minute, you want to out supplement the way that you're living the other 23 and a half hours of your day. Like that's not going to happen. Like there's nothing, it's not going to happen. And yeah, herbs are wonderful and beautiful, like you said. But there is so much greater impact in the just regular foundational things. We use herbs to like pulse biochemical pathways, right? To like change them, like zoom, 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 zoom. And they do change things, and it's great. It's awesome. But again, if you're not, anyway, I just fully agree with everything that you said.
Yeah. And then the last thing I'll leave with is just nervous system regulation. I don't think this gets enough attention. And again, it seems kind of abstract. And I myself am still learning the best way to guide patients on this, because it's kind of different for everybody. But I think a lot of our nervous systems are fried for many different reasons. And that is also the foundation for our hormones. So diet is important, absolutely. But I have also had the patients, and I have seen it, where they eat quote unquote perfectly, they exercise perfectly, they sleep perfectly, they did everything perfectly, and they are still very imbalanced. And it's because of their nervous system dysregulation. And that could stem from trauma, childhood trauma, current trauma, extreme stress, unresolved grief, hypersensitivity. Like they are just a sensitive person. So living in like Wi-Fi and on their computer and on the screens and in the traffic and all this stuff is just like frying their nervous system. So it's different for every person. But really working on that, I think, is like another really key foundation for hormone balance. So that's what I have to leave you with. I've shared my guide again for the labs. And if you guys are interested in joining my membership, I have all of the goodies of how to practically, actionably do all of the stuff of rebalancing inside of there. So thanks.
And the show notes will be filled with a bunch of different episodes, the free lab guide, the membership information, all of that, so that you can continue to dive into more resources.
Perfect.
Thank you.
Thanks for listening to this episode of the Healthy as a Mother podcast. In order for others to hear this information, please leave a review with Apple Podcasts, subscribe, and send to a friend who could benefit from this content. We're so excited to share more on becoming and being a mother next time.
And please remember that the ideas and views of this podcast are for informational purposes only and are not intended to serve as a substitute for medical care of any kind, including the diagnosis or treatment of any illness or disease. Consult with your provider before integrating this information into your own care plan. And remember, a healthier future starts now, and it starts with you.